Welcome to EHI TV. I'm Shanna Crispin and this is eHealth Insider's Essential News on Video. Towards the end of last year, the European mHealth Alliance was responsible for setting up the UK's first mobile health ecosystem in Manchester. With me to talk about what this actually means is Bleddyn Rees. Welcome.
Morning.
First of all, you're a London-based lawyer specialising in healthcare. What's your involvement in the ecosystem?
I'm head of the firm's healthcare practice at Rag & Co, and we have a real interest in the development of connected health, e-health. And I started working with Brian O'Connor a few years ago, and we've been looking at how we take some of the ideas that are around in industry and actually make them real and get them deployed at scale. So it was natural to become involved in the development of an ecosystem in the UK.
Okay, and you're involved a lot with contracts as well to do with setting up the ecosystem?
Yes, the sort of mechanics, if you like, of setting up the membership of the ecosystem requires some arrangements to be agreed between both the NHS organisations involved, the private sector businesses, and what we're trying to do is keep that to a minimum so that we don't frustrate and make it difficult to pursue the membership and the deployment of mobile solutions, but at the same time ensure that there's an acceptable level of governance. So we're trying to strike that right balance.
Okay.
Brian describes it as the coalition of the willing.
Okay, now let's talk about some of that terminology. An mHealth ecosystem, it's a little bit obscure. What does it mean?
I think at its most simple, it's about creating a population of patients that is sufficiently large to deploy at scale mobile health solutions. The ecosystem as well involves, I think, bringing together all the participants necessary to achieve an integrated care solution as well. So, for example, it's about making sure that you've got a sufficiently large number of patients, obviously, but that you've got primary care and GPs involved, that you've got commissioners, and that's PCTs and the new commissioning consortia groups involved, that you have the hospitals and the acute care, whether that's district general hospitals, tertiary hospitals, also specialist hospitals, so in Manchester a cancer hospital and a mental health hospital, and then getting the local authority involved, so from a social care angle and a public health angle, so that, if you like, all of the participants who are key to deploying these solutions are involved and getting the ability to shape and facilitate the deployment of the solutions.
Okay, so some of the projects that you're involved in this ecosystem include mobile technology for monitoring mental health patients, mobile access to patient records, and social networking for patients. With all due respect, we've heard about pilots of these things before. What's this going to change?
I think the whole system demonstrator, for example, is and the results are now published, and I'm sure that many of your people know some of the statistics, which are perhaps surprisingly impressive. But that's only 6,000 people. What the ecosystem in Manchester does will be potentially deploying against the greater population of Manchester, some 2 to 3 million people. So suddenly you're going to have the ability to deliver services at scale for the benefit of patients in a much more meaningful way. And also we're going to be able to, rather than just have industry pushing out a particular solution, we're going to be able to join up both the commissioners and the providers in NHS organisations to the benefit of all patients. So potentially the ecosystem is something very different to initiatives around single deployments by one PCT or one group of GPs in the part of the country. So it's potentially much wider application.
Right, that's great. Thanks for your time. That's all we've got time for this week, but be sure to keep an eye on our news pages for further updates on this story.